Periodontal disease is certainly not fair. Some people get it a whole lot more than others. So if your parents or grandparents had it, you may get it a lot more than somebody else. So I always say, I hope you love our office. I hope you refer people. But if you refer your buddy that you went to kindergarten with, okay, don't be surprised if I tell him, hey, come in every 6 months for your cleanings, you're fine. But I may tell you, nope, you can't, because you've got more bone loss than you should have for your age. And here's how I tell, okay, not good at diagrams, but here's your enamel. On the healthy covering of the root, there isn't any enamel. When we're about 15, our bone is like right there, okay? So if you come in and you've got more bone loss than you should have for your age, chances are it's hereditary. And I tell people, think about it like there's an allergy factor. Everybody understands allergies. So I say, hey, if you and I went outside and they just cut the grass, I might be able to rub grass on my skin. Nothing happens to me. You walk outside, you're sneezing and your eyes are watering. It was the same irritant. One guy has a huge response. It's like that with mature bacteria underneath the gums. So if you come in and I see that your bone level is lower than it should be for your age group, I say, boy, you start in, you're just gonna have regular cleanings with us, and instead every 6 months, you have them every 3, okay? For those extra cleanings, we don't take x-rays, we don't do an exam, there's no other fees, it's just you gotta get the little instruments under the gum to where the battle is. So for those people, we say, we don't want 91 day-old bacteria living under your gums because it causes bone loss.